Welcome, welcome. Thank you for being here. I'm Allison Weingarten with the Clearinghouse for Worker Safety and Health Training. Great to see so many of you at this evaluation community of practice call. I just want to do a little housekeeping before I turn it over to Eric. So please keep your accounts on mute unless you are speaking. If you do wish to speak, you know the old trick of putting your hand up and asking to speak. You can also utilize the chat for conversations. We will be posting some questions. We may be posting some questions in the chat box. As you all agreed to when you got on, we are recording this session, so thank you. And with that, I'm going to turn things over to Eric Prasad, Health Specialist for the Worker Training Program.
Hey, good day, everybody. Thank you for taking the time to attend this evaluation community of practice. We've heard you loud and clear over the last several sessions that this historical meeting that we've had in the past, especially during COVID-19, has been informative and helpful to folks in getting together and sharing resources and knowledge, developing possible partnerships as it relates to training and evaluation. We recognize that the recent supplement for disasters put a sense of urgency to make this a priority topic, which is why, as our first back to doing evaluation community of practices, we wanted to include disaster training as it relates to the supplement, but also make it pretty clear for everyone else on the call that while the supplement and disaster training is the focus of this call, it is not the only focus. It is not limited to just those folks. So if you're doing training in general or disaster training in general, I hope that you can find this useful. If my screen will allow me to advance, there we go. So I'll just say a couple opening words. Dr. Rosen Baldano will speak about logic models and common questions. Then we'll have some discussion on that. Then we'll move to Dr. Riley about sharing on innovative ways to do disaster evaluation and training, maybe more than just the pre and post test, but thinking differently on how we can reach audiences. Allison and Chip will have a discussion about the DMS system as it relates to disasters and the supplement. And then we'll have a very open discussion towards the end for things that we didn't get a chance to address, or if we ran out of time for different sections to go back to it. Once again, this is a forum for us to talk about evaluation practices and challenges and share together, mainly not just for you all and helping each other conduct evaluation, but making sure that we understand what's representative of the grantee and the grantee community and the occupational health and safety training community as we prepare to put together language on how we communicate evaluation to the public. We also recognize that there are requests for more of these webinars going forward, and that a general evaluation may be more appropriate for the next one, where we go over basics of evaluation and how that looks like for the worker training program. We understand that disasters happen quickly. It is too late to think about evaluation when a disaster happens. That's why we're here, to think about reaching intended outcomes before they happen, think about the ways that we do it, and capturing the voices of trainers and workers, but also recognizing the value that we can help to bring to you in things that remain a gap and challenge that we could provide to you, and use the arm of the clearinghouse as well. We've had many historical responses, for example, COVID-19, the Gulf oil spill, and we could share some of these informations with you. They're publicly available on surveys that were used in the Gulf oil, as well as an evaluation plan for COVID-19. We are also working to produce simplified logic models, and much of the discussion that will happen today, as well as what's happened historically, will be used to put together logic models and simplified logic models, some recommended evaluation questions, and an evaluation draft plan that you guys can use and capture the language that we're using as well. These are working drafts and they're not finalized, but they're here to kind of help, because as these will be posted later on, for your thinking and for your thought process. We're also working on a simplified and overall logic model as it relates to the disaster and disaster supplements. This was using kind of a framework that's already existed in the past with COVID-19 and kind of modifying it to shape it to look like disaster response, but still a working draft, recognizing much of the discussion today and discussion that goes forward will help make sure we make an informed and appropriate model for you all. And I use those to kind of segue, because we know Mitch is going next. And he's going to kind of lay some foundations about logic models for a lot of us and kind of drift us towards that discussion and how we could think about those kind of frameworks and models. So take it away, Mitch. Thank you.
Thank you, Eric and Allison, and it's good to see everybody here today. So I'm going to talk a little bit about logic models and what they are and why they are. But first, if you could answer this question, you can just put the letter of your response in the chat box, so we can just get a general idea of what your experience is with logic models. All right, well, thank you for answering. It looks like a lot of people have moderate experience with it. A couple of people with a little experience. We've got a couple of experts. So Eric, why aren't you doing this presentation instead of me? So,
Because
anyway,
we trust.
What's that, Eric?
We trust you.
All right, thanks. Okay, so this will be a refresher for a lot of people on, those of you who have moderate experience, and a little bit more information for those who have little experience with logic models. So the purpose of logic models is to provide a roadmap to describing the sequence of events connecting the need for your planned program with your desired results. So it's this graphical display that lays out the relationships between your program resources, your activities, your outputs, and outcomes and impacts. And this really is like an if-then relationship. And I've got a slide and a couple of slides that really shows that among the program elements, that if you do this, you get that. If you do that, you get that. And leads its way to the outcomes and impacts that you're so desiring. And it clarifies the boundary between what the program is doing and the so what of the program. The intended, it changes from the implementation of the program, the what you're doing, and can focus on any level of an enterprise or a program. So it could be an entire organization. It could be, say, an NIEHS logic model, or it could be a component or program with it. It could be a worker training program logic model, or it could be a grantee of the worker training program and show specific parts of that program and how they build up and build upon or build into the other outcomes and impacts that the larger programs may have. So they could be built upon each other, they could be standalone. So many of the grant programs in the federal government ask for logic models and including them for the project that you have. So logic models communicate the purpose of the program and its expected results. What are the long-term outcomes that you expect from your program? What are some of the shorter outcomes that you have? What are the outputs you have? And I'll talk a little bit more about that in a second. So again, it's describing the actions that are expected to lead to desired results. And they become a reference point for everybody in the program. It's a graphical image of mapping out your objectives. And you can see from that graphical what your resources are, what your inputs are, and what your outcomes are. You can involve stakeholders, you incorporate findings from other research and demonstration projects, and you can look at obstacles to the program operations so that you can address them early on in the planning process. So generally, they're displayed on one page, they're visually engaging. they're audience specific, they're appropriate in its level of detail, because you don't want to put too much detail in, but you don't want to leave things out so that you don't have enough detail in it. And again, it's useful in clarifying the activities and outcomes. They're easy to relate to, and they're reflective of the content in which the program is operating within. So the parts of the logic model, or the components of the logic model, are the inputs. These are the resources that go into a program or an intervention. And then there's the activities that are undertaken by the program or partners to produce the desired outcomes. So they are the activities that are based on the resources that you have. And then the outputs are the outputs of the activities that you've done, so that the results of the activities. And then the outcomes are the results of the program, and they're short-term, intermediate, and long-term outcomes. And sometimes these are called impacts. So the immediate effect of the program, the intermediate are the, some of the maybe behavior changes, some policy changes, and the long-term or the desired results, and can take years to accomplish. So our long-term goal is to improve the workplace culture by blah, 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 blah. That could take a long time to do. So, and then there's some assumptions that go into them. And those are the beliefs that we have about the program and the resources that may be involved with that. So here's a nice graphic from the Kellogg Foundation Logic Model book. And it talks about the resources of the first part. So certain resources are needed to operate your program. And before, when I said it was an if-then approach to it, so if you have access to your resources, then you can use them to accomplish your planned activities. And that's the second part. The third one is if you accomplish your planned activities, then you could deliver the product and services that you intended. And if you did that, if you accomplished your planned activities to the extent you intended, then your participants will benefit in certain ways. So these are all building upon each other. And then the impact or the longer term outcomes is if these benefits to participants are achieved, then certain changes will be expected to occur. So the first part is your planned work, and the second part is your intended results. And again, they're if-then statements. And when developing a logic model, sometimes it's useful to think about, instead of from the resources side to the impact side, to build them a little bit backwards, looking at the impact that you desire, and then what some of the outcomes are, and working backwards. Sometimes that helps you in terms of the planning of your logic model. So if you're not familiar with the NIEHS PEPH evaluation manual, the evaluation metrics manual, it's a great resource just to have. I've got a link to it later in the slides, and it shows an older graphic of the WTP's logic model on its evaluation of inputs, activities, outputs, and impacts. And there's this feedback loop throughout the process. And so I thought this was a nice simplified version of a logic model. And here is the logic model that was developed for the program in 2012. So it's a little outdated, but it's still relevant. I think there's a lot of relevancy here. And you can see the inputs include partner agencies, continued funding, the grantees, trainers, et cetera, program staff, leading through certain activities that lead to certain activities. If those outputs are achieved, then those impacts could be done. So again, they lead to, it's a graphical display about where you're going from how you have the resources to start the program through the long-term impacts of the program. And Eric showed this one. This was the biosafety training and infectious disease response logic model. This was the simplified COVID-19 logic model. So that's kind of where I wanted to take us to this point. And I'm going to turn it over to Megan in a second. But to think about the value to create a simplified logic model for the disaster supplement, what we should be including in that, and what are the resources available to us? What are the long-term outputs, and what are the outputs and the impacts that we want to achieve? So we can start thinking about that in a few minutes after Megan does her presentation. Here are some of the resources that are really nice and valuable for you to include or to review. And at this point, I'm going to turn it over to Megan, who is our evaluator, who's my evaluator. And I love this graphic because, you know, it reminds me that every time that Megan asks to collect data, it reminds me that this is what we're supposed to be doing. And this is what we said in the first place. So she keeps us on track. So she is our walking, talking evaluator and logic model experts, kind of interpreter for us as we go through our process of evaluation. So Megan, I'm going to turn it over to you.
Okay, so I'm going to be talking about common evaluation questions. And I just wanted to start by sharing our experience with common evaluation questions within our own center. So we have a number of sub-awardees within our center. They're listed right on the screen, right over here. And we all use common evaluation questions. So we basically have a website that our center members go to that houses all of the forms, all of the registration and evaluation forms, and they can just click on their agency name and pull up the forms. So this is one of our evaluation forms, and it's branded for that sub-awardee. So even though it's a common evaluation form across our whole center, it's branded specifically for them to use and has the same questions. And we also have registration forms that are kind of similar. We use the same registration demographics questions across our Atlantic Coast Center. Also, I wanted to mention that these are the paper versions, but we're using Qualtrics, the digital version, basically across our entire center. Most of our center members and us at Rutgers were almost exclusively doing the Qualtrics version of these forms. I just put the paper ones up because they're a little bit easier to see. So here's an example of the same evaluations across our center, just individually branded with everyone's logos and colors. So because we do this, because we have common evaluation questions across our center, I can easily combine all the data from each individual sub-awardee into this massive spreadsheet. And I can see just at a glance how each individual center member is doing, what the evaluations are saying just for their agency. And then I can see it as a group. So I can merge it overall and see how our center is doing that year. Oops. So because of that, I can merge all of our data together and I can come up with nicer looking graphics that I can share in our progress reports that give a snapshot of how our center is doing based on the course evaluation. So these are just two examples of that. And that's possible because we use these common questions throughout. So WTP also has some common evaluation questions, and this is kind of like a recent history of those common evaluation questions going back to IDRT or the Ebola grant. Those two questions that were the common suggested questions to include on evaluations were: the training has prepared me to recognize infectious disease hazards on the job, and the training has prepared me to safely respond to infectious disease events on the job. Those questions changed a little bit for the COVID supplement, and the suggested questions were to recognize COVID hazards and then respond to COVID hazards. The most recent version of those suggested common questions is recognize hazards and control hazards. So there's kind of a theme throughout these questions. It's always a recognize question and a respond question. And then we just put those in our evaluations, our center evaluations. So I highlighted, we just dropped them in right on our form. So it's pretty easy. I wanted to link back to what Mitch was talking about with the WTP logic model. Those two evaluation questions that are the common questions actually relate to the short-term impacts on that logic model. So trained workers who can recognize workplace hazards and trained workers who understand how to take action. So I know the benefits for us as a center using common questions across our center. And I'm thinking that the benefit to using common questions across the entire program might be similar. We can see how our center is doing, but we can also see across the whole program, are we meeting our goals, our short-term goals of training workers who can recognize hazards and respond to hazards? So we have some discussion questions, proposed discussion questions on logic models and common evaluations. Just wondering to hear from everybody, what would be the value to creating a simplified logic model for the disaster supplement? Also wondering, is anyone using common eval questions in their center? Are you using the WTP common questions? And are there other ways that we could use common questions or eval methods across all of our centers?
Yeah, thank you, Megan, Mitch. That was
Sure.
incredible and very simple and laid out from start to finish on how, you know, we look at logic models and common evaluation questions. And I just want to open it up to folks if anybody has any questions or comments and maybe even thoughts on what you expect intended outcomes to be, as well as maybe some common question ideas or themes that you think are important. All right, well, not hearing any questions, I guess I could take the privileged position. um, what do you all think are your intended outcomes when you think about these disaster supplement trainings? What are you intending to achieve?
One of Eric, one of the things that we're looking to do is to build some sustainability of programs down in Puerto Rico, and for, you know, people who live in Puerto Rico, to train them in disaster response and other types of training, so that they have the confidence to respond after a storm and during normal times, and not have to rely on people flying in and flying out to do it. So it builds this competency and sustainability within the island. So that's one of the goals that we have.
Yeah, and that really resonates well with some of the stuff that was mentioned in Puerto Rico when we kicked off. So I think it's valuable that that continues to go forward. All right, why don't we head over to Kevin so that we can get people talking, because he's got some Jamboard and that sounds pretty pretty interactive. So Kevin, Dr. Riley, why don't you carry us away?
It's a lot of pressure, Eric, but I'll do my best. Well, thanks for bringing me on, and Megan and Mitch have done a very nice job of setting up where I was going to take this. So this should flow really nicely. So I was asked to facilitate a discussion here on evaluating disaster training in unique and innovative ways. And where I thought we could start is on this topic where Eric has already brought us here. That is, you know, what are we sort of looking to measure in terms of outcomes and impacts when it comes to training specifically related to disaster events? When we were in Puerto Rico a couple months ago, some of us were kind of having some conversations around this and realized that, you know, when we're thinking about disaster related training, that training is often unconventional compared to other kinds of worker training we may do. I mean, if we're lucky, some of that training may happen prior to disaster events, but in a lot of cases, we're trying to roll out training and education in the midst of unpredictable environments related to hazards which we may or may not have anticipated. It can be often very difficult to be engaging with trainers or trainees, participants, in those settings, given that there's so many other priorities that folks are trying to address. And it can be difficult to follow back with people afterwards to try and do that documentation and that sort of understanding what our training helped to contribute to the work that they did on the ground. So what I thought we could do is sort of start off, we've got a little Jamboard here that you all can see, and you all are going to have a chance to interact with this Jamboard. Let me put the link here in the chat. So if you all click through on that link in the chat, you can get onto this Jamboard yourself. And for those of you who haven't used this tool yet, on the left-hand side, you've got several options. About halfway down, you have a little symbol that looks like a sticky note. One above that, whose mouse that is, that one, right? So any of you can go ahead and start, brainstorming some ideas and dropping them here on our board, and let's see what comes out of this. But let's start by just thinking about, if we're thinking about disaster-related training, what kind of outcomes or impacts are we looking to document? What do we hope our training does? And what do we want to use evaluation to be documenting going forward? What do we hope that disaster-related training will do for folks? So go ahead and drop some ideas here. Let's look at some things that come out from this discussion. Give folks a minute to play around here. Does everyone see how to use this? There we go. Okay. Yeah. So you can up and stick and then you can move them around too, since they all default to the same corner of the screen. And actually, I can help with that as well. Let me just get it myself. All right, this is great. So we're getting some really good ideas here. Awesome. Okay, so I'm starting to look here, and folks can kind of help me out as well. Where are we seeing some similar themes? What's popping out to you all as we see these responses coming? Feel free to jump off mute and contribute to the discussion with it. And I think in particular, one question that I wanted to pose to the group is also about how much are these outcomes similar or different from other kinds of trainings we might do? I mean, in some ways, these outcomes aren't very different from a conventional 40-hour class or an OSHA class, but in other ways, I think the fact that we're doing training on disaster issues and in many cases into that disaster settings, makes it a little bit different. So I definitely see a pretty strong through line here in terms of preparedness, which I think is really important. Making sure that the training we're doing is happening before events take place and helping to prepare people for whatever situations they may encounter when going out of the field. What do folks see here? Anything jump out at people in terms of some of these responses?
Yeah, it definitely seems that capacity building and being able to respond not just the event that's immediately being responded to, but being able to respond to future events is resonating a lot. And that makes a lot of sense because we talk so much about capacity building frequently and emphasize it so heavily.
Yeah, and what I particularly like about some of these responses here is it's preparedness not only for individuals, but then you have on the left, it looks like several of these about building organizational capacity and resilience, which gets to, I think, the importance of training, not just for individual responders, but for organizations they may be associated with, for communities that they're coming out of or going back to. So those, I think, are important measures for us to be thinking about in terms of some of our evaluations as well. All right, folks, any other observations or comments? I see you're off mute.
Yes, culture changes. I think you were just getting to that. So, looking, there was one that I saw there, and they moved around, but looking at culture changes within organizations and systems. So I think that's a really cool long-term outcome or impact of that we're looking to get to.
Hey, Kevin, this is Deborah. So the question is sort of covered up, but I think this was a broad question as opposed to a question about the disaster supplement specifically. And
Right.
I feel like in some ways there's a difference in that because the disasters that people got special funding to respond to have already happened, there's sort of more planning before the training happens to address some of these specific communities, whereas a lot of the disaster training or some of the disaster training that's done is in immediate response to a disaster that's just happened, which tends to be much shorter
Mhm.
training than otherwise could happen, and that could otherwise happen through the HDPT sort of preparedness. And so I'm just wondering if there is a need or value in trying to distinguish between those, because I think what can be accomplished with each of those is potentially different.
I think it's a great point, Deborah. And I will say, I think you're absolutely right that if we're thinking about training either, well in advance of events, or as you're saying, sort of like doing more maybe planned or anticipated kinds of training following events as the cleanup and recovery is happening, that's certainly one, what we want to capture and how we're capturing it is going to be different than when we're, immediately on the ground responding to a hurricane, responding to a wildfire. Go ahead, Chip.
Hey, Kevin, just in sort of discussing this yesterday with the worker training staff, this question about target populations and having a sense of who it is that we're talking about was another factor, like what Deborah said about what the phase is that you're in, a preparedness versus response versus recovery. But then what are the roles of the people that may be being trained, and then what's their function? But then going back to this question of how do you improve whatever it is they're supposed to do. So we were sort of talking about that as another question, specifically around the supplemental disaster awards, but also in general, bigger, geeky kind of Eric kind of, question on evaluation. So, yeah.
Well, one thing I hope this activity can do is, going back to one of Megan's questions, I do see a value in having some sort of logic model underlying that we're doing under the supplements. And I'm hoping that, partially the ideas that are generated through this activity can help to inform what that logic model might look like, right? That I think there's some great outcomes here and impacts that we may want to make sure to capture in terms of the work that we're all trying to do.
Yeah, it seemed the other part of that, Kevin, too, is how do you actually measure this, of what's a quantifiable, measurable outcome that might relate to what it is that somebody knows before they come to training, and then how does that fit into, a better response, a better recovery, about what their role might be. So, yeah, in terms of what another part of what we got to figure out probably with the
So
logic
Chip,
model.
you've just set me up so beautifully, and I didn't even.
I know, I'm trying.
You have not even coordinated.
You pay me, it's okay.
So
Next
the next part here, I just wanted to also spend a little bit of time about, maybe not quite getting to what you're raising in terms of, how to quantify these issues. But I think the other question to spend time on is just the methods of rolling out evaluations. What's the process look like, and what kinds of tools might we be thinking about to reach folks that we are training, that we're engaging with on the ground? So if who's ever sharing the slide, if you could just flip to the second screen there for a second. We got 3 different slides. There we go. And this one we don't have to spend too much time on, but if folks do want to interact with this screen, you're more than welcome to. So I think, all of us who have been doing worker training for a while, we recognize that we have some kind of standard conventional tools we may rely on for rolling out evaluations. It may be observations of our trainees, whether it's in class or in the field. It may be the use of things like questionnaires, which Megan was sort of showing us in terms of the surveys that they use, or maybe one-on-one interviews with folks, again, during or after a class, maybe focus groups. I think these are probably not unfamiliar to us here. And if folks want, you can use the little pen feature at the top on the left, or there's also a shape there feature on the bottom. If you want to just mark up, what do you all use right now in terms of evaluation tools for your own programs, disaster related or otherwise? You can make this a little bit more broad. I'm assuming we'll get a lot of folks saying use questionnaires. Am I right? Yeah.
Kevin, this is Jamie Burgess from IAFF. I do want to
Sure.
highlight something that we're working on with Dr. Sarpy, actually, who's on this call, and regarding the questionnaires, we're taking a little bit different approach than what we've done in the past. Instead of only capturing feedback from the students, because a lot of the training that we do is for entry-level recruit firefighters. One of the things that we're doing is we're also capturing feedback from the firefighter's supervisor, because what we're trying to highlight is, does the behavior change that we're hoping to accomplish with the student, does that translate into more of an organizational culture change? Because a lot of times, the students' supervisor or coworkers, they may not have taken IAFF hazmat training. They may have got it somewhere else, or they may have taken it, so long ago that they've kind of lost some of that knowledge and skill set. So, by capturing the supervisor's feedback, that really helps us gather that our training is having an impact beyond just our student base, that it's actually affecting organizational change. So
Exactly.
I think that was a pretty unique approach that we previously hadn't done before.
That's great. And I think it is such an important component to be considering here, the moving beyond the individual sitting in a classroom to the larger organizational change, system change that we may be aiming for in the work that we do. It reminds me also of, a project that a couple of us through university programs had done several years ago, kind of doing a comparable thing with our trainees, going back to managers, supervisors who are sending folks to our trainings to have a better understanding from their perspective of how is it that their employees that are going through our classes, how are they able to bring that back to the workplace and inform safer work practices, identify hazards, respond to issues as they arise. But it's a smart way to go.
And Kevin, this is Sue Ann. One thing just to add on to what Jamie was saying too, it also allows, I think Mitch was talking about this a minute ago, with the idea of the system, it also allows you, we know that having those supervisors support and managerial support in terms of safety climate, in terms of really having sustainability of the behavioral change, in terms of really seeing impact of the training, if you don't get a feel for the extent to which they're supporting and encouraging what you're doing, your training can be very, very effective, but will it have legs on it? And will it have change and sustain change? Probably not if it's not supported.
That's right.
And so I think gathering that can be a little tricky, but I think it's a really important construct we should be measuring.
Yeah. Thanks, Suan. Lucas, I see your hand. And we can't hear you even though you're not. Gonna try again. All right. We'll circle back to you. All right. We'll try you again in just a minute. There's one more thing maybe I'll do on this section before we pivot, if you want to go to the third slide. So this kind of gets at my initial mandate for this section is to think a little bit about alternative evaluation methods. So we were just looking at some that I think are fairly conventional, ones that we use probably fairly frequently, but starting to think about some other alternative methods that we may use, especially around disaster related training, to document some of those impacts of that training. So it may be, might be things like simulations or scenarios or case studies, which I know a lot of us use as classroom tools to assess learners' skills and competencies. This is something that we could be thinking about kind of in a more, from a kind of a more evaluation perspective. There are strategies to do evaluation using social media tools, podcasts, webinars, ways to try and demonstrate learners' work, share best practices. Maybe different kinds of storytelling approaches might be good to capture narratives, capture people's reflections. So I want to open this up one more time. You can interact with this. What other kind of interesting, creative, unique evaluation methods might folks be aware of? Maybe do you all use in your own work? Anything here we may want to just use a little bit of time to share some creative ideas. Feel free to populate anything you may want on this slide here with some other thoughts. And maybe as you all do that, I'll also put it back to folks if there's anyone else who wants to sort of chime in on this discussion. I appreciate some folks
Yeah.
coming off. in
Are
chat.
are you able to hear me now?
Yeah, we can hear you.
Okay,
Go ahead.
fantastic. Thank you. I'm Lucas Holler from Nova Southeastern University. We've been interviewing the folks who send us their workers for a while now. And we just actually presented our findings at the American Public Health Association, looking at not just the extent to which the trainings have been resulting in organizational cultural changes, orienting around safety, but what I heard from a number of constituents who sent us their trainers is that their workers are actually taking this information home. And they're spreading
Yeah,
this awareness
great.
and this culture, not just within the organizations, but inside their communities
Yep.
as well. And I thought that was a pretty exciting sort of development to see taking place.
Yeah, thanks for sharing that. I think that also is such a creative way to think about the impacts of this training, that people having more agency in their homes to make changes as well. Maybe they're encountering some challenges in the workplace, but if they implement changes in their home, that can demonstrate that they're at least learning something and acting in some way. So this is great. Just looking at a few of these ideas that are popping up. I saw G's got a point about photo voice and chat, which I think is a great tool. We've got video and text feedback. Yeah, okay. We've been asking trainees if they have a story to tell, right? Just opening it up in a more general way rather than maybe using questions that are so directed. WhatsApp chat exchanges. That one's an interesting one too. So does anyone want to, in the last minute or two we've got here, anyone want to chime in on us a few more details about any of these techniques you all use? There's some great ones here. I'd love to hear about the WhatsApp, not to put someone on the spot. I don't know who put that in there, but
I could talk a little bit about, it wasn't me that I just put
it
it
was
in.
you.
This is Arturo.
Yeah.
But that's something that we use a lot with our worker centers, because a lot of the classes are virtual. People sign up ahead of time in a WhatsApp group that takes care of any technical issues. That way we can support the students. And even after people complete the class, people stay in the chat groups and they ask each other questions after the class. They ask how to fix the situations, and that's also a follow-up way that we use for them to ask for additional training.
That's great. That's great.
A WhatsApp suggestion was mine, Kevin. And I am familiar with that chat, particularly in the international settings. It's highly used.
Mm-hmm.
Also, folks tend to use it to exchange voice messages. It's a cultural thing.
Right.
It's not something that happens much in the US, but in an international setting, people really send a lot of voice message to each other all the time. So that was my
that's great.
suggestion. Both these were mine. And
Cool.
Arturo, I'm glad to hear that it does actually occur.
Excellent. Yeah, thanks. I think being it to the technology people are most reliant on, I think, is a really important piece of all of this. Fantastic. Anyone else want to weigh in on these? I really appreciate all these ideas that are being generated. Hope that this is also helpful in terms of feeding back into a kind of a logic model and structure we may want to be thinking about across our projects.
Yeah, thanks, Kevin. This was great. It kind of really brought out the discussion that Megan and I were trying to do, verbally, but I think, having it on the Jamboard was great. So thanks for doing this.
Great. Well, with that, maybe I'll hand off the mic.
Yeah, thank you, Kevin. I appreciate it. I think right off the bat, we taught a lot of people about Jamboard, so that already gets some trainers perked up. And we got some discussion going, some valuable discussion. And, the language you guys provide and share with us, not just with the other grantees, but with ourselves, helps us better recognize how we communicate evaluation and how we communicate, things that we need to get done as we think about going forward. And I know that we have Allison and Chip next, and they want to share some more deliverable oriented stuff. They're going to go into DMS and communicating that out there. So take it away, guys.
So I'll let Chip do a little facilitating, but I'll give you a little background on the questions. So we want to utilize the DMS, which you all use, to share information. And the purpose is to help overcome some of the barriers and communicate its importance. So we have a couple of questions. Chip, do you want to give any more background before I go into the questions?
Yeah, oh, totally, yeah. We don't want to hit them with the questions. That would just bum everybody out, you know? No, oh, seriously, no, what we're trying to do is use this process as really a test bed with the DMS. I don't know if you know, if you're going to be a future grantee, we're in the middle of doing the platform for the DMS is going to be being transferred and kind of revamped. So we're trying to really look at the utility of both what information is collected as well as how it's collected, and try to make it as easy as possible for grantees to use. And one of the things that we have that's mocked up and hopefully will be shared with folks in January is we've tried to revamp the input for the disaster training supplement courses so that they're all geotagged and actually connected to a FEMA declared disaster that would be pre-populated into the system itself when you pick where your training happened or who you're training, et cetera. So part of what we wanted to roll out to you today was just to give you a heads up that that's coming and that we're going to try to experiment with more granularity in terms of the information that's collected, but hopefully not make it too much of a hassle to do that. So what Allison was going to lay on you, I don't know, you got to put up the questions. As we discussed in Puerto Rico, we were trying to figure out how to figure out training schedules and where training's happening, the old, projected versus make actual. And I know that we haven't released the DMS special circumstances website click button for disaster training, but that's what we're going to try to do. And then sort of the second part of the question would be whether to be able to get training accomplishments more in real time, not wait till the end of the year, because what we're trying to create is a process where we can keep up with what you're doing and your accomplishments and your training, and then be able to communicate that back both to people in the region, people locally, as well as the Congress and other agencies. So those are in the chat are two questions that we wanted to kind of ask you about and get some feedback about. Allison, you want to say any more about what we're thinking?
Yeah, I think, from our perspective, it would be extremely helpful to have that information and to be able to share where trainings are happening. And then other providers could say, I know people that could benefit from that training. I'm going to link them up. And, that's also the benefit of that real-time information, because, we can figure out what's going on and we can all be doing this together. So from our perspective, that would be great. But then we understand that you are the people actually doing it. So my question to you are, what do you see as the benefits and what are some of your concerns?
Yeah. And I guess the other part that we did calls with each of you, which were really fantastic. We really got a lot more insights into each person's program, each group's program. And we want to keep up those lines of communication.
Just each of the 9 disaster supplemental grantees. So not everybody, but
I know.
some great conversations.
Yeah.
There's a question from Megan about, are we willing to accept the information in another form outside of the DMS? Absolutely. We would prefer it that way, but if not, we certainly want to have the information if you're willing to provide it. So
that's amazing. I would love to share on a more frequent basis in an Excel spreadsheet in the way that we keep track. That would be great. In the DMS in its current form is so challenging for me to update. keeping track of the proposed and making actual. I end up just mass deleting the proposed and then entering actual as a spreadsheet at the end because it's just kind of impossible. So to make it monthly would be extremely challenging and not preferable for me as a user, as a frequent user of the DMS.
And I think a big concern would, but you know, it's great to hear you say that, Megan. The concern is, oh, I already have to do DMS and now I have to do this other form. And I am with you there, Megan, that like, you know, put together a shared Excel doc that, you know, we can enter some numbers into would be great. And it's wonderful to hear that feedback. So I'm wondering what other people think. Rania?
I just wanted to echo what Megan said, that, you know, having it updated on a monthly basis may be a challenge given, you know, how we enter things and working with our, with the staff that we have that does it. And also, I don't know how everyone else handles it, but, you know, our partners who send us the information in order for us to input it into the databases can take some lag time because they're far, they're out, they're remote, they're doing trainings. So just saying that there's that added level of challenge to the information to come to us in order for us to update it. The monthly may be a bit of a challenge.
Yep.
Would there be?
No, in the chat,
flexibility?
there's great questions. If people check it out. Hey, Charmaine.
Hey, Chip, would we have flexibility in making changes to the information? So if a training is canceled or, you know, we reschedule for another time, would we be able to do that rather than waiting, you know, on a monthly basis, kind of like real time changes?
Yeah, I mean, I don't, the new version of the system that will roll out, I'd actually have to talk to Lynn in terms of how robust it would be for swapping out or updating. But that we were trying to get kind of what your concerns are so we could give that to the designers to be able to create some flexibility for the users. Thinking back to Doug and the uploaded spreadsheet that is now the dominant way that people input data. Really, the government does listen to you guys, okay?
Mitch?
I think a couple of things. One is the second question, willing to enter training data into the DMS monthly. What exactly would you be looking for in training data? So, you know, that's kind of a global question. The other thing is that, you know, a comment on which Megan referred to before about the projected data being put into the DMS is, for us, it's kind of like just a task that we do. And, you know, as Megan said, it's like, you know, at a certain point, we just delete it all and do it. So I think if there's a way that we could eliminate that step, that's one less thing we need to put in. Maybe there's a way to, you know, upload our work plans into it so that we don't need to say, you know, and kind of make up data, you know, because we don't know when we're going to do courses, but we know over the year we're going to do, you know, 10 courses in this and 12 courses in that. So those are just two comments.
Yeah.
I wanted to
Definitely.
mention that the Community College Consortium collects our data on a quarterly basis. If you could consider that, please.
Yeah. No, I think we were just trying to figure out what you already do anyway. And obviously everybody has a different process of how you do that. But we were just trying to look at a way to compile information on some more regular basis than at the end of the year. So
It's a great
that's kind of where
idea.
yeah.
Great idea.
No, also folks in the chat, if you want to talk about what you're doing, Arturo, Jen, if anybody want to chime in, for your comments.
Yeah, at least for us it might be a little challenge to put it monthly for the second part, just because so many of our trainees, for example, do the OSHA 30-hour. There is a waiting period to complete that, and then handing the card to the students is a real issue that we face.
Yeah.
Was a live document that, you know, sort of in the spirit of meeting you where you're at, you could add what you know when you know it. So, you know, there are some projected things at this point. You have an idea of what you're going to be doing in January, February. And then if it happens, you know, in the next column, you write down if it happened. And that way, you know, Kevin is posting something and someone who knows of workers nearby that wants to go to it can see it on this document and say, oh, hey, I'm going to call up Kevin and let him know that this is happening, if that makes sense.
Yeah, I think we didn't want to hijack this discussion about evaluation for this one point, right, Eric? But we did want to raise it up with people to think about, and it is a data collection challenge that we're trying to figure out better and easier and more accurate and more timely ways to do it. So I think that's why we had this today. So I think that's good. And we'll take all of your questions back to Lynn because she's working on the design. So.
And I see Kevin's hand up if you wanted to say something.
Yeah, so I don't know how much further you wanted to go down this road or not, but one quick question I guess I want to just ask is, Allison, your example you just used, is that part of the goal here is for there to be kind of a broader sharing of when trainings are coming up for people to join? Because the other thing then that triggers for me is we would want to make sure to be clear, you know, some trainings we have are with partners and there may or may not be space for outsiders to join. So that might be information we would then want to be communicating back to you. That's part of the goal that you're trying to achieve.
Yeah, I think that, I mean, the other piece, Kevin, that we talked about before was that we were talking about having some regional briefings, which would let other agencies know that you guys exist and that you're doing training that you may or may not be able to meet, or they may or may not want to come to training, but you know, we hopefully that will make more awareness of the program and also may result in additional training happening, whether it's disaster or whatever. But yeah, that was another goal, I think, is to potentially have more target populations for training in the disaster program. So, yeah. Right.
Great ideas. Thank you, everybody.
Thanks, Sean.
Yeah, I really appreciate, you know, Chip and Allison. I know it's hard to tell them apart. They're like basically twins, but they're really great. And I appreciate, you know, the efforts that they've been pushing to do with the data management system and being mindful that our goal is not to overburden you all, right? That is not the achievement that we're trying to get. Our goal is to help facilitate and help you all. And that's why we're having this call. And that's why they're asking these questions. We're trying to make things optional. We're trying to make things that are useful to you all. And we hear your feedback. And if, you know, it doesn't resonate with you, then we wouldn't do that to you, right? But if we feel that there's a community that says, hey, we want this, that we could use this, we want to be there to do that for you and provide these venues and opportunities for you. Allison Chip, for example, with that DMS system could be of great value in how we understand and deal with these disaster events and going forward, and how we understand data and the sharing of it, but so much more than that. And that's why I kind of wanted to give a little bit more time towards the end to think about not just the DMS stuff, but and even more broadly, what are things that you need from us? What are some future steps you want to see from us? We what things that we can deliver to you all. And the last thing we want to do is add more meetings to your calendar. We chagrined that we made sure we only had this meeting because there was such a demand for it. So we want to make sure that next time we bring people together or we put things out there, it's because you guys want it. So I want to open that floor and open up that to a healthy discussion. Like, for example, we know that you guys conduct trainings in different languages, right? And in the DMS right now, we don't really have that specified. Maybe you might want to make a remark about it. If that was to be an option, maybe in the DMS for the specific disaster supplement, just to kind of get a pilot of it, that might be an interesting opportunity, as well as understanding that the population of workers that you guys train are various. They're not always specific groups. Some are day laborers or volunteers. That might be of interest as well. And maybe you might have some thoughts on that. And I know Chip has his hand up.
Oh, no, I didn't mean to eclipse you, no. No, I was just thinking a couple of things we talked about yesterday about kind of identifying target populations in some kind of way. I don't know if you all remember, like back to bird flu, infectious disease, COVID. We really, and DOE, we really tried to identify specific target groups so that there was a way to characterize the target population. So we're thinking about that. We're not sure how to do that at this point. The other piece, I think, Eric, and I'm not sure where this discussion is about common outcome measures for the disaster supplement grantees, and whether having some common outcome measure about Kevin's first slide about impact on the community or on disaster preparedness or whatever. I'm not sure where we're at with that. So I guess Eric and everybody, that question.
Yeah, I think a lot of the conversation that we're having, and some of it that Kevin facilitated with the Jamboard, we're going to really rely heavily on that. Looking at your applications and things like that to make sure that when we think of common questions, when we think of logic model, we're using a grantee-driven mentality. So that may make sure that we're using resources and functions that best suit you guys. But if anybody else wants to chime in.
Kevin, are those?
Yeah, Mitch, I was going back to like a prehistoric era when evaluators all talk to each other,
Right.
or not.
Right. I saw that Ruth was on, right? She's done this. So
exactly.
I lost my train. So Kevin, the data that's on those Jamboards, is that kept someplace that could be downloaded and shared?
Yeah,
I
Sharon
just put it in the
mentioned
chat box.
Yeah, so you can capture it yourself. I mean, I'll keep the Jamboard live. You can keep, you can refer back to it, but having it as a PDF is good.
We've
Okay.
already saved it as a
Oh,
PDF
perfect.
and
Excellent.
Yeah.
Good.
Thank
Yeah,
you,
because
Karen.
I think that'll be really helpful as we look to develop a logic model for this program and review the logic models for the overall NIEHS program. And I think I'm a big proponent of using common questions across the country for evaluation questions, even if it's just the two that we've been using for the past couple of years. I think over the last couple of years, I know we've kind of calibrated some of our evaluations with Pete and Kevin and Dave and some others, so that we're kind of asking, either if it's not the exact question, it's a very similar question. So I think that leads towards some of the the outcomes that we're expecting, and then as we collect more data, we can think about some of the longer term outcomes and impacts that we can all collect to see how the program is really is the impacts that the program has bigger than just any one of us have.
Yeah, thank you for that, Mitch. I think, and we stress it so heavily that we're a collaborative bunch, that this is not common in some federal grant programs and in worker training programs that grantees can share and come together so often, so frequently, and so willingly share data and resources and knowledge to overall grow and empower workers. So I appreciate that. Thank you. If anybody else has, anything specific that you might have in mind that you wish the clearinghouse or some staff folk at WTP to be putting together or thinking about more, we'd love to hear it. This is your opportunity.
Yeah, Eric, I'll just say, Chip here, obviously earlier Jamboards, we're looking for stories of impact and how we actually collect those. I don't know that we have a system except the annual progress report. So I guess what we're saying, like wink, wink, if you want to send us some really good stories, that'd be great, but it's on you. So is that the right way to bureaucratically say it, Eric?
Oh yeah. That's how we do.
I'm not a bureaucrat. Let me know.
No, but in all seriousness, those success stories and shared stories that you guys provide resonate deeply when we talk about the program to congressional folks or justification folks, and it means a lot. Of course, the numbers are very important, and that goes a long way. But when you hear about workers' lives being saved and trained and protected and turned around through these programs, it's real. It's resonating, and sometimes Sharon and I just read them just to get through the day, right? Because they're so meaningful to folks. And if you have those stories and want to share them in interesting ways, we'd love to see them. And Christy's on the kind of hand up. I hope she's not going to yell at me. Not just.
No, of course not. No, this was great. I just actually had one request, I guess, or as you're thinking of the stories that you want to share and the data that you're collecting, Eric, I just want to remind, I guess, you and Sharon, of how often we have to report on our partnerships with HBCUs, with community partner organizations. So, however, and I would say there's sort of two different things. So there's sort of a race ethnicity reporting component to it of like, are we reaching out to organizations that have historically been underrepresented or that we have underfunded or that, those kind of things. And then there are other questions of just sort of partnerships with community organizations. So I know that is something that your program has historically done very well, very often. And so I think, just to the extent that that is something that y'all can key in on when you're looking at how you're setting up your global data collection, that would be super helpful. And
No, that's a great point, Christy. She stated something that, to be real, we get a lot of data calls and we get a lot of requests about the program because of the great work you're doing. We get frequent requests on data. And we assure you the things that you provide to us get used. They don't just get read and put away. They are frequently used. Pete, you have your hand up in my row.
Yeah, thanks, Eric. So I don't know if anybody's heard of this before, but I'm going to post the Telling the Story project, which is a collaboration amongst the University of Minnesota, Iowa, and Nebraska. Their 3 agricultural safety and health centers, NIEHS funded, as well as the National Farm Medicine Center. Anyway, I'd forgotten about that until the last. I was reminded of it in the last week, and it's really cool. But it's a systematic effort to try to tell stories of people who have managed to injure themselves on the farm through one way or another, and their goal to try to tell their stories so other people will not be injured in the same way. So it's kind of it's a really a wonderful project, but it required some extra funding to do some of that. So there are people dedicated to kind of working on this as part of their their extra funding. So but it's a really good model, so I wanted to share that.
Yeah, thank you, Pete. Appreciate it. It looks pretty cool. Ronnie?
Yeah, from the perspective of just equity and justice in this realm, I wanted to bring up the issue of working with our tribal partners who may not and some of our other community partners as well. But I know that we've seen that with some of our tribal partners in the past where folks, I mean, of course, WhatsApp would be great and I'm all happy about it and all of that, but people sometimes don't even have a flip phone in certain settings, and even getting pictures from some of our partners, for example, in Alaska, in order to be able to place them in our reports, even that has been a challenge, let alone some other longer story version. So just wanted to put this under the, in the lens of justice and equity, if we're going to think about really hard to reach, or just, wanted to just bring that up. Like, we don't want to leave people behind by getting too techie and too involved, because there are some stories that will not get captured and will not be told if we evolve too much, in a sense, and don't evolve some of our more rugged, old-fashioned systems of just talking and reaching out.
Yeah, that's a really important point. Kind of aligns with what Christy had just said. A frequent data call we get is on American Indians and Alaskan Natives and those tribal communities and training there. But yeah, we understand that that's not easy to do. Sometimes you train 2 people and it has just as much impact as training 100 people, because of the impacts those 2 people have in such a small rural village, right? So I think that's an excellent point to make. And oh, Mitch, I see your hand up.
Yeah, I think it'd be great if there was like either in the DMS or elsewhere, an opportunity for us to upload stories on a routine basis. We get a comment in our evaluation, or we have a conversation with somebody that we can just, push here, dummy, and it gets uploaded, and then you've got it. As opposed to waiting until the end of the year to put some of them into our progress report. And then, with the progress reports, there's limited real estate that we have to put stories into it. So it just, things get left out, or, something happens in July, and then we forget about it by May when we're doing our report. So if there's an opportunity to do that on a more regular basis, that would be helpful.
So I can chime in real quick, and this is probably more for Sharon and Eric than the rest of you guys, but the Core Centers program and the Children's Centers program, a couple others, I think, they have a highlights form on their webpage where it's set up for exactly that reason, so that people can sort of quickly enter in stories without having to wait until their annual progress report. That is something, and Eric, I just sent you a separate message about OMB clearance. Anyway, that is something that we need to get OMB clearance on. We are actually getting ready to start that renewal process. So this would be a perfect time if y'all want to add a similar type form to the worker training program page somewhere. It's easy to do. So we can talk about that more offline. We hear you. And I think we have an easy solution that we can implement pretty quickly. And pretty quickly for the government, meaning a few months.
We're already getting results. For those of you not aware, Christy's like our evaluation guru at NIEHS, so I'm thankful that she was here to attend. Does anybody else have any thoughts or comments? I know we're getting a little bit close to the end of the meeting. If you guys want to break out in Christmas or holiday carols, we can do that too.
Well, Eric, since we're kind of getting a little bit towards the end, and I think most people have given most of their remarks, if you don't mind, I would like to close it out today, and unless somebody has one last thought that they need to give or want to give. 5, 4, 3, 2, 1. All right, so I wanted to say thanks to Eric, Allison, Chip, Mitchell, Megan, and Kevin, and the rest of the Clearinghouse staff, and our DIRT program analysis branch that helped to organize and to give feedback for this webinar. Of course, each of the attendees for participating and providing feedback to Chip and Allison on our disaster supplement work. That was absolutely important. And most of all, I want to say to everyone, be safe and have a happy holiday season. And we'll certainly be communicating with you about how we want to move forward on our next steps in getting this information from you. So please take care and enjoy yourself. Take care.